Hi, everybody. This is Erica Mello, and welcome to Tough to Treat. In this episode, Susan and I discuss a patient of mine who had, quote unquote, a disc issue. And at the end of the day, we really clinically reasoned through, the differential diagnosis of is it a disc, is it an acute, exacerbated nerve root, and he's had some lingering issues with in his legs. So we basically talk through the whole evaluation and really give you some great clinical pearls on what to look for in this type of patient, as well as how to progress somebody who's somewhat plateaued but needs to move forward rather quickly. So I hope you enjoy it. Hi, everybody. This is Erica Mello and my wonderful co-host, Susan Clinton, and this is Tough to Treat. Welcome, Susan.
Hi, Erica. How are you?
I am good. And for the audience, Susan has a bit of a laryngitis, and today we'll be talking about my patient, but that's just FYI. I hope you feel better.
Thanks. I don't feel bad. I just
Yeah.
have no voice.
No voice. I know that's lousy, especially someone who, as we're teachers anyway, and we talk and talk and talk all day. So, you want to get ready? You want to start?
Yeah, let's do it.
Okay. So this is a patient of mine who I'm currently treating. He's a 56-year-old male, and came in to see me literally right before the July 4th holiday. Typically, I'm going away, and I heard, and I've got to get fixed, so type of person. So he came in to see me with right butt pain going into his shin, primarily on the lateral part of the lower leg into the peroneals, occasionally into the front of the shin, anterior tibialis. Skip the thigh, so right butt into the lower leg. Nothing into the foot. No pins and needles, no numbness, no weakness, no myotomal issues in terms of motor power. Coughing and sneezing, bowel and bladder, all negative. Nothing really exacerbated it. What was interesting with him, I'm going to give you some history first. He's the kind of guy who loves to do everything. Runs 2 to 3 times a week. He trains with a trainer once a week. We have the city bikes here. He city bikes home to Brooklyn from Manhattan where he works, and that's not a short trip. So he does that about 3 times a week and runs and works out. So he feels the precipitating incident was he started biking a lot more to get a little bit more exercise. Then the same day he ran. So he biked from the city home, he ran, then he worked out with his trainer all on the same day. And the next day he had his son's high school graduation where he sat a lot. And then the next day he's a baseball coach for one of his he has three boys. And the next day he started, coaching with the baseball team, and he pushed it, quote unquote, I pushed it. And then he had a party for his son's graduation from high school, and he was doing a lot of lifting. So this is a lot of activity and, normal activity basically, but in a short amount of time. He did a lot of lifting. The next day, he had butt pain right down into the leg. So that's when his symptoms started. He's told me he's often, when he worked out with his trainer, he noticed that everything was always harder on his right leg. He would do a single leg deadlift, always had a hard time stabilizing on that right side, but he never had any pain. He went to see a chiropractor, a chiropractor person he's seen over the years, and they diagnosed. I'm not sure if it was a he or a she, but they diagnosed him with an SI sprain, quote unquote. No real relief after. I know. It's like,
sorry, I'm making a face.
I know she's making a face. I'm like, you gotta love it. It's like, then then you're gonna love this one. Then he goes to these urgent care clinics here, and they diagnose him with the hamstring strain. I'm like, hamstring strain? How did you get that? His hamstring's not even involved. Then he ended up, so he got an Xray. I believe the chiropractor probably manipulated him. He was slightly worse. Looking back on it, it makes sense. He's pretty hypermobile there. He ended up getting an Xray. Then they went to the ER. I mean, this is like boom, boom, boom. He's not dying, so he probably didn't get treated until eons. They gave him a diagnosis of sciatica. Wasn't really getting much better. Then he saw a family physician, a pediatric orthopedist here that his kids saw for some years. He gave him a cortisone shot in the butt. Not a ton of relief there. They did an MRI, and they found that he had a right L4-5 disc protrusion with possible impingement or contact of the right L4 and right L5 nerve root, significant bilateral foraminal narrowing. So, makes sense looking at it. I mean, he probably has had that for a while. He also has his past medical history included just a left groin, like a left cam impingement on his hip many years ago. But other than that, he's pretty healthy. The only other past medical history of note is he's in the music business. He saw the chiropractor again, actually. They did this applied kinesiology, that muscle testing that they do. Then he sees an acupuncturist. He travels quite a bit on the plane. So the main issue with him is that it was July 2nd, July 4th, he had plane tickets to London. And basically had tickets to see The Who at Wembley Stadium.
Ooh.
And I'm like, oh my God. So that's the dilemma I faced. And what aggravated him, which is very interesting, was sleeping. He was worse in the morning, okay? The sleeping position. He tended to sleep on his tummy with a little bit of a side-lying right position. And what basically felt better was sitting. He felt great sitting, no problem. Sleeping was worse. Walking bothered him, obviously, but he was generally okay, quote unquote, during the day, he told me. And I was like, interesting. He did wake up with sweat, a lot of sweating, went through 2 soaked t-shirts when this started. And I was like, that's not normal. And once again, this guy's extremely prone to anxiety, has under a lot of stress. So he said that in the morning, so the back end in the morning was worse. That throughout the day was generally okay. And at the end of the evening, much worse at night, at the end of the day and at night. So I will stop there. Do you have any questions at all?
I do. Which leg was the one that was bothering him?
Right.
Okay, the right side.
The right side.
Okay.
He has a history of plantar fasciitis, et cetera, but nothing really.
On the right?
On the right, correct. He wears custom orthotics.
How long ago was the plantar fasciitis?
Probably at least 6 years ago.
Huh.
I don't know. I didn't write it down.
And he still is wearing orthotics?
Yes. He's still wearing orthotics. You got to love it. Still's wearing those orthotics.
And so, me and plantar fasciitis, I always think that's neural tension.
Yeah.
So
yeah, no, I agree.
This has been going on for a while.
Mm-hmm. Yeah, no, I agree. Totally. So I took a look. I mean, he was shifted, obviously, right lateral shift, pelvis to the right, which was ironic because that's where his problem was. He, significant asymmetries. I kind of just look at that, but the obvious standing issue was pelvis to the right. His thorax was to the left. His head was to the right. I mean, nothing really crazy.
Mm-hmm.
So he was really, I will tell you, Susan, he would have literally, if I sat there and talked to him the entire evaluation, he would have been happy. He was so stressed and so high strung. And he was in the music business. And I said, look, he really, and basically was taking his wife and one of his sons as a graduation present to London. And he really wanted to go. And I was like, okay, can't go this way. So I was like, in my mind, I'm like, he needs to be on a steroid, at least to get him on the plane. Because he at the end of the day, this is a once in a lifetime experience. And so in my exam, I just had him do a forward bend. He was completely fine, no problem. I was like, okay. Back bend, we just had him do a back bend. Obviously low back pain with that, no shin pain. Into a right side bend, that's what got him. I mean, right zinger right into the shin immediately from the get-go. I had him do a wide base of support that centralized it. So I had him do a wide base of support,
Mm-hmm.
right side bend. He just had back pain, nothing in the shin.
Okay.
No myotomal deficits at all. Reflex is fine. I did a slump test, which was negative, which was shocking, actually. I did a straight leg raise, which was negative. I did a prone knee bend bilaterally, which was negative. And I'm like, this guy's got a flared up nerve root, but his neural tension test at this point. So at the first visit, they were all negative.
Mm-hmm.
And I watched him walk, and every time he walked, he would go into this sort of right side bend. He just couldn't stabilize himself well on his right side. So after that's what I saw. And I talked to him a lot. I mean, I literally had very little time to do my objective. So I was like, look, I'm going to contact your physician. You need to be on a steroid dose pack just to get this inflammation down. And if you want to go to London. And the doctor basically told him he'd be crazy if he goes. So I contacted the physician, and I said, look, this guy can't even sleep. He needs to get some sleep. What do you think about putting him on a dose pack for 7 days? And he's like, good idea. Let's do it. So he did. And I saw him, let's see, when did I see him? So I saw him literally the next day, July 3rd. I think I saw him July 3rd. I'm just going back to my notes here. Yes. Okay. He wasn't on the Medrol just yet. He was just about to get on it. He said he was sleeping a bit better. Just after talking to him and explaining to him that this is a common issue, he told me he was sleeping a bit better. He wasn't as tired, and he was thinking of going on the trip. I retested him. All the objective exam was still the same.
Mm-hmm.
I actually did some intravertebral mobility testing on him, and it was completely normal. Hypermobile, to be honest. No muscle spasm, nothing, no stiffness, nothing. So the main issue was going into that right side bend, and that's what got him. And my personal thought was that he obviously had an aggravated nerve root, or he's impinging something that was going into his shin. I know I can stop now I can tell you what happened. So.
Yeah. So I find it interesting that, his history speaks to the clinical exam. Oh. He can sit without problems. Walking is more of a problem, but laying down really gets to him.
Mm-hmm.
And he sleeps in a position that takes him into that right extension quadrant.
Right.
So for whatever reason, something is gotten a nociceptive stir up in that region, and it's just going to take some time to settle it down.
Yep.
And this neural tension piece, it doesn't seem to come on unless he's in compression.
Right.
So you have to take him with his feet loaded. You have to load him to bring it on. Mm-hmm. And the reason that I bring that up is because when you take him into a wider base of support, he just has low back pain.
Right.
So that makes sense to me with the walking, because he has to stand on that one leg. Mm-hmm. And sometimes maybe he was doing that shifting over to the right side bending before he even had a nerve root or whatever this issue is.
Yes, I probably, yeah.
Yeah, and, something's gotten sensitive in there for sure. Yeah. And, this using the dose pack is just a stopgap measure to, get him more comfortable.
Yep.
To do some of the things that he wants to do, which is, like you said, this lifetime experience.
Yep.
What I really find interesting is what you really did with him is much more of a biopsychosocial approach, because you recognized that there was a lot of other overlay on top of this. That it's not just a simple biomechanical type of issue. That this is, there was a lot more to it. And by taking the time to talk to him and really hearing his story and hearing all of those pieces, it kind of gets back to the narrative again. He really needed a chance to really talk about everything that was going on. Mm-hmm. And he was better the next day because of it.
Yep.
So it makes me think about a sensitive nervous system
Mm-hmm.
much more than it, and oftentimes the sensitive nervous system isn't going to show up like a nerve root impingement. So you're not going to get the dural testing, because this dura isn't irritated. So
Right.
you weren't going to get the straight leg raise, slump test stuff. And the slump test I would expect to be negative because he sits okay.
He sits okay.
Yeah, and
Right.
he flexes okay.
Right.
So it's more
Right.
of more when we wind him up into extension. What I'd
Mm-hmm.
be interesting to see is, and you really didn't even have to do this, but what would be interesting to see is if you crossed his legs and hadn't bent over. I wonder what would have happened there.
In
Yeah,
standing. Well, that's a great idea. I'm,
just a thought, but otherwise, to me, it seems like you've got a sensitive um, thing going on here in the right side of his lumbar spine.
so you mean just in standing, cross his legs, just literally cross one over the other and
Yeah.
do a forward bend? Okay. What do you expect to happen there?
Well, I would just want to see if that brought any of his symptoms on.
Correct.
Looking at neural
So,
tension. That's all it
exactly.
is. That's all I'm doing
Yep.
is kind of trying to wind him up a
Crossing
little bit
midline.
more.
Yep.
Because when you brought his feet together and had him side bend right, it made everything worse. But when you brought his feet
Mm-hmm.
apart and he side bended right, he was better.
Correct. That's
So
correct. Yes. Exactly. Yep.
okay.
Yeah, no, I like that. I was actually thinking of doing an extension slump, sitting him up in extension and just winding the leg up there. I had a note to myself to do that, and I just didn't do it the next time, but I'm actually seeing him again this week. So I will do that. So, yeah, I would agree with you because he basically said to me, he's like, if all we do is talk today, I'm happy. I mean, and I was like, right then and there, I knew I need to sit down with this guy and calm him down and I said, your MRI is, you have it, you got it. It's just a baseline, and you probably had that for a while. It just got exacerbated with whatever you've done. And this is an extremely common problem. You've got some inflammation and et cetera. So I agree. I think when he came in to see me the day after the eval, I was like, he's like, oh, I feel better. And I'm like, but the only intervention I did was talk to him. Seriously.
Mm-hmm.
And I, obviously I had to move, but so he basically said, I think I'm going on my trip. And I'm like, oh my God. So I said, you just need to take that dose pack. So the second visit, I did a lot of, I wrote in my notes here, a lot of pain education I wrote down. I explained a lot. I actually, did a little manual work. I mean, I thought, he's like, my hip flexor feels tight. I'm like, I went in there, looked at the psoas just to sort of, because he was very, very like, not manic, but very focused. And I worked on the psoas for a little bit, and then we have some Pilates equipment. So I took him out into the gym, and I did some little things on the Cadillac just to open up some decompression, like push-throughs. I had him do some roll downs, literally just to give him the sense that he's doing something. He's asymptomatic. I had him walk. I said, this is what you need to do if you're thinking of going on your trip. I didn't give him a yay or an nay either way on the trip because the physician's like, you're crazy. And I'm like, well, it's a once in a lifetime. I'd be drugging myself up the wazoo to get myself on the plane to see the Who at the Wembley Stadium. So, and I didn't tell him that. I told him that after the fact. And that's what I did. And he's like, I feel better. I feel better. So
novel movements that were not going to feed into his sensitivity.
Right. And I said, this is if you have to carry and walk. I said, I would not suggest lifting because if depending on what arm you use, it could really pull you into that side bending on the right position. Just be aware of that. Try not to get into that position. Have your wife and your son carry for you. And when you're walking, if you need to sit a little bit, just sit, take it easy. So he ended up going. Okay. So I was like, look, it's your decision. He's like, oh, I feel better. So he went business class, flatbed, no problem on the plane, got there, texted me like 5 times, but it was fine. I was like, I'm happy to give you my cell phone. The guy, I knew that having that, he would feel better. And so he was fine. He did fine in London, just went to the Who, had a fantastic time. They went to Abbey Road Studios. I was like, oh my God. Came back. And the issue that I had, and I'd love your thoughts on this before I continue, this excessive sweating at night. Okay. And it's gotten better, but it's still there. I said he's going to see his physician for a physical next week. I'm like, you need to mention that. What do you think of that? I mean,
So, given all of the history and everything,
yeah,
what the first thing that strikes my brain, I mean, it could be a lot of things, right? Night sweats are
right,
not normal.
right.
So those are red flags, and you have
Mm-hmm.
to got to get
Mm-hmm.
something done about those.
Mm-hmm.
Um, but if all things were equal, it kind of makes me wonder. Um, this guy is definitely living in a cortisol-rich environment.
Totally.
I mean, he just is. He is unable to switch out of the fight and flight because he lives in it. And now, is that a bad thing? I mean, stress is good for us. It helps us get things done. But when it's excessive and our response to it becomes abnormal, then it's not such a good thing. And it sounds like that he's having an abnormal response to something going on. Now, I don't know if that has anything to do with his back pain or not, but
Yeah.
he needs to. Yeah, they need to like look at that and do some inflammatory marker testing, and or I would actually call the doc and talk about it and just say, this is what's really coming up now
Yeah.
for him. But I'm just wondering, even doing some cortisol testing and just seeing how high his levels are.
Yeah.
Because I mean, this guy is super living in a cortisol rich environment. And the
Mm-hmm.
thing is that there's no balance in there. He exercises, which is great, but, and he can do some stuff and he's pretty resilient until it all got piled together.
Yeah.
With all the things that he had going on during that one particular period of time.
Yeah.
Now, what I don't know is if that's normal for him to have these
Right.
clusters like that.
Right.
If those clusters happen all the time, or if that was kind of a unique situation. But, given his work status and the type of work he has to do, somewhere in there needs to be some balance for him.
Right.
And
Right.
he's not getting it. And that may be what's driving, the situation at nighttime.
Right.
Because if your system gets, too overrun, it's not going to rest as well as it should.
Right. I mean, when I first saw him, he was a mess. He got no sleep.
Mm.
And I said, is this normal for you? He's like, no, this is the first time this has happened at the sweating. And
Mm.
he had a cardiologist appointment. I was like, last week, which he ended up not going to. He forgot about it. And I said, you need to go to your physician about this sweating. It's not normal. And it could be just basically what I said, it could be your high stress environment. I said, but you need to do that. He's going next week. So, because that was just completely threw me for a loop, and that's a major red flag.
Mm-hmm.
I agree. His wife is ill. I mean, he's got a lot of high stress right now. So that it makes sense, but something inside me said, you know what? If he wasn't going to the physician, I would make him go. I would say
Mm-hmm.
make the appointment. So, and I certainly can call the doctor as well and find out. But,
Mm-hmm.
he's off the steroids now, and where I am, so basically, when he got back, he was still shifted. His lumbar, his backward bending was fine. So I had him repeat a forward bend. He was a little bit achy at the end of the range, nothing really crazy.
Mm-hmm.
At this point, we are stuck with this right side bending issue. So when he was away, I said, look, you need to just make sure you don't develop a weakness. Walk on your toes, walk on your heels, let me know. Like all of a sudden, if you get foot drop, you need to text me and let me know. That never happened. Okay. So he's got pretty decent power. And I was like, that's your barometer and when you're away, because I don't know what's going to happen when you're away. So the issue is the sleeping. So I basically had him try to sleep on his right side. So he ended up, you good? So he ended up sleeping on his left side. Didn't really help him. Actually, it made it worse. It makes sense because he's lying on that left side. His upper right is, and it's lying on his right side. He felt better. Basically in terms of I didn't do a ton of manual therapy on this guy, and it's unlike me, but I did, and I worked on his hip flexors. He didn't really need it. He didn't need to be mobilized. He didn't need to be stretched. He didn't at all. And a lot of it is biopsychosocial with this guy. A
Right.
large part of it is. And uh, I've been doing some things on the Pilates equipment, basically opening tech, opening things,
Yeah.
flexion. That's what I've been doing. And I've been making it up, have him doing a TRX squat, things like that. Uh, to make a long story short, I'll condense a few visits in. I had him do a deep, I said, how far do you squat? He did some really deep squats and he had shin pain. So I elevated his heels. I said, do a deep squat if you can. And with the, just stand on a half foam roller and just squat all the way down. And it was significantly better. I said, okay, if you want to squat, just elevate your heels. Okay. So probably some neural tethering at some point at the bottom of the squat, or you could be, something mechanical could be happening there. This past weekend, he ended up swimming a lot. He played catch, walked a couple miles, much better. The shin pain has dissipated quite a bit. However, it is still there. So during the day, he's pretty good. The morning is the worst for him. And I saw him, so I'm going to condense a bunch of things. I saw him yesterday, and I gave him a lot of child's pose down dog. Once again, opening things, resets, things to really sort of decompress. But what I'm still getting with him is when he side bends to the right, he still gets it significantly better. He can go much farther. I had him take his orthotics on it. I said, give me your orthotics. They're hard orthotics. I worked a bit on his foot at some point. I'm looking at my notes just because I thought perhaps there was some issue in the foot because his plantar fasciitis was flaring up a bit. And when I saw him yesterday, you're smiling. And I saw him yesterday. He was like, I think my plantar fasciitis is flaring up. And I'm like, no, I don't want to do that. So that's where I'm at. I know I'm kind of a little all over the place, but the right side bending still gets him. His foot's flaring up. I looked at him on and off the orthotics yesterday, just basic side bending, back bending, off and on the orthotics. No real change in terms of symptoms, to be honest. So I ended up putting some tape on his foot to offload, to give him some distal offloading, and his right side bending was significantly better. But that could have been a treatment effect. Who knows? When I saw him yesterday, it was, once again, the symptoms were easier, but the main issue is the morning. That's the issue now. He can walk. I had him do some forward lunges. He's like all over the place. He has no stability on his right side at all. And I was explaining to him, I said, that's, you've always been that way. And that may have been one of the things that played into it, but that's not the cause of your problem. So I'll stop there and you let me know what you think.
So my thoughts are he's still in the need to calm things down stage.
Yeah.
And that it's just, he's got a sensitive central nervous system going on here. Yep. It just really, really does. And, the nighttime stuff needs to be figured out. Does he stay on his right side when he sleeps now with his knees bent?
He starts there and then he ends up going on to partly on his tummy. So he's a little bit on his right side, but he's half semi-prone. So prone, left head cervical rotation to the left on his right side, but he's in that extension, like in that.
Yeah, so he keeps going. He keeps turning himself right back into the position that sensitizes him.
Correct.
So he needs to just kind of keep, he just got to wake up and change positions again. Wake up and change positions. What's he doing in the morning to calm everything down?
He does some child's pose I gave him. He just basically moves, walks around, and he feels better. Good. Does a few child's pose, calf stretches, little things I gave him, but other than that, it's just really the movement, I think.
Right. And, so, with the stuff that he has going on, again, that brings me back to, he was doing fine when he was playing catch and doing fun things like that. He needs to find a way to get some of that joy back in his life and, and do some calmer things. All the exercise and stuff is good. And, there's a lot going on with him. There's a
Yep.
lot.
Yep.
And, I don't know that anything other than good novel movement and taking him out of movements that are sensitive right now and then re-exposing him back to those sensitivities as he begins to change would be the pathway that I would take with this guy, because this is really, and that the heels kick it in because it's part of the pattern. The brain smudge is there, and so as he does different and new things, he may notice that. So you just kind of back out, find the edge of it, and work through there, and stay out of the things that are really super sensitive, and stay in the parameters where things feel better, just to get them through that, calm things down before you can start building things up.
Yeah, no, that's actually a great idea. And I think that,
and it sounds like you're already doing that with some of the stuff that he's working on, because he's not having symptoms as he does it. So
oh no, zero. I mean, except with that deep squat, but I was like, okay, well, I'm not worried about that. But you're right, because he did play catch, and he did a little bit of a walk and the hike, and he felt good. He's distracted, number one. And it's the sleeping. And I said, look, you need to really sleep on that right side in that fetal position, and it's hard for him to do that. He's off the Medrol now. I had him doing Tylenol two Tylenol 3 times a day. I'm weaning him off of that, but I said, look, you're still getting this in the morning is because something's still inflamed. I mean, that's pretty obvious. You're not even 4 weeks to your injury. I'm explaining to him the time frame here. Typical. I wanted to go on tomorrow. I'm like, this isn't going away tomorrow, honey.
Yeah.
Okay.
The sensitivity's been there for a long time.
Yeah.
This is not a new thing. It's just that it's gotten, the sensitization has really taken a bigger leap this time.
Yes.
And it might be good for him to take a look at some of those resources. What's the name of I'm looking, hang on. Does he have Netflix?
Yeah, he has Netflix. Yeah.
There's a series on Netflix called Heal.
HEAL.
Yeah.
Oh, I didn't know that. Very cool.
Talks about the mind-body approach.
Oh, nice. That's a new one on me.
And there's also a documentary out there, I've not seen it yet, called The Connection.
Ooh, that's another good one.
Yeah.
It's right up my alley. Is that on Netflix too?
That I don't know. I'd have to look it up and see.
Okay, I can.
But, there's some good stuff out there.
That's fantastic.
It might be helpful since he's kind of a focused guy.
Yep.
That likes that kind of, maybe getting him on the Recognize app and letting him do Recognize back and Recognize feet. And because it's a game, and, might be something that can help kind of the right-left laterality issue that's going on with him, since it's all specifically, so much onto one side. So you can start dealing with some of the laterality stuff, and you're doing a lot of the crossover things and movement things, which are really good. But that can help his brain piece of it.
Yes,
and, and let him understand about the exposure. That, pain doesn't always equal harm, particularly in his case at this point, so we can, help him with that a little bit. But some of those things could be very helpful.
Yes, it's fun.
Just keeping with that so that he understands that it's not him that has created this, but it's just an output, an overprotective output that's going on.
Yep.
Mm-hmm.
Yeah, no, I agree. I mean, I had mentioned the Recognize a while ago, but we never followed up on it. I'm not sure why. It's right, I think, at the beginning, but that's a great idea. I'm all about Recognize. I have all my patients go on it, but his stress piece was so predominant,
Right.
And I like that. So, and I bet you, Susan, and I can report back, if I just gave him that, I guarantee you he'd probably be significantly better in the morning, because his nervous system would just.
And that could be something he could do first thing in the morning.
Yeah.
He'd
love it. He'd love it.
Get on his right side, do a little bit of that, see if it starts to make a difference for him.
Yep. And he's the kind of person, so I think in terms of novel movement, I'm just going to do what he likes to do. I'll play catch with him in the gym. I'll throw balls. I'll get
Yeah.
him on the, do whatever. I mean, he can do a handstand if he wants. I mean, we can do the David Butler dance or whatever, in one of his
Hmm.
videos, he has these dances. It's something, whatever he enjoys doing, basically. And
Yeah.
I'm happy to play catch and things like that. So, uh, I think the moral, at least with this guy, is yes, he had some significant. Obviously, he had some significant issues, but that wasn't the overarching theme.
Right.
I think with him, it was really just a lot of psychosocial issues, and still to this day,
Yeah. Is he
and
seeing anyone?
no, no, he's
Do you have a
not.
good cognitive behavioral therapist you can send him to?
I do not. I'm sure I can grab some references here in the city,
Yeah.
and
Might want
yeah,
to explore that with him too.
yeah, yeah.
Because with everything that he has going on, and if his wife is ill, you said his
Yeah, I mean, I don't
wife
think
is
she's
sick,
horribly ill, but definitely, I mean, they have
but there's a
physical.
lot going on. There's
Yeah.
just,
Oh, yeah.
and sometimes, like one of the reasons I bring that up is he says, if all we do is talk, I'm good with that. It's like,
Yes.
yeah, because
Correct.
he needs to do that,
Yes. Correct.
so
Correct.
it'd be great to have him with somebody skilled to help
Yes.
him be able to kind of like
Yep.
maybe solve some of the moving parts in this life, or
Mm-hmm.
problem solve around some of that.
Mm-hmm. Yep. Absolutely. Yeah, I think that'll be good for him. And he wants to revamp his whole training program. I'm like, look, things happen for a reason in your life.
Yeah, now's the time.
Now's the time to do it and get on the program. So, I mean, with him, he's like, what's the normal pattern with these things? Like, I think it's for him, he said, as long as I know it could be 8-10 weeks, I'm feeling good. It's expectations. We have to manage their expectations in the end.
Yeah,
And
that's why I think it'll be good for him to have some of those resources
totally.
about
Yeah.
the biology of pain.
Mm-hmm. I agree
Just
totally.
really understand,
Mm-hmm.
be able to kind of get in there and think about it in a different
Yep.
way. That it's not a cause and effect
Yep.
type of situation here. That we've got a sensitive nervous system we're dealing with.
Correct. And he
That
said, can I do some lunges? Can I do this? I'm like, yeah, go for it. If you want to do it, go for it.
yeah,
I'm happy to, I'll watch you. And I watched him
that's the
yesterday.
thing, is that he needs to get the message that pain doesn't equal harm.
Yes.
And for him, that do the things that you want to do.
Mm-hmm. I
It's
agree.
okay. It's
Yep.
okay.
Yep.
What you need
Totally.
to watch out for is doing a cluster like what just happened,
Mm-hmm. Mm-hmm. Oh, yeah. He
with all of
gets
that.
that. Yeah.
Yeah.
And I think that. So it'll be interesting to see on his physical with regards to the sweating. Interestingly though, he told me that the sweating's gotten a lot better.
Yeah.
And I'm like, you still need to mention to the doctor
Yeah.
because that's still not normal, but
Yeah.
it's going in the right direction. And that's that. I mean, I thought this was an interesting case just because I just started seeing him, but I thought that managing, somebody like this at the beginning, he absolutely wanted to go see the WHO. And I was like, okay, let's figure out a way, the doctor's
Mhm.
like, you are crazy to go. That's what you are crazy if you go. And I'm like, when you're 90 and you look back on it and you miss the WHO, I would have gotten myself on that plane personally and drugged myself out I mean, seriously, it's a lifetime experience. And obviously, he was feeling better and such, and it was no harm done,
Mhm.
to be honest. I think having him stay home and be miserable would have been worse given what we know about him.
Yeah.
So
Exactly.
that's that. So I actually will just post it when we do the next one, just because I think this is a good learning tool, good case to learn. Well, they're all good cases to learn from, to be honest. But I will keep everybody updated on him because he's a current patient of mine. So that's that. I hope everybody enjoy it. Thank you,
Sounds
Susan.
good. Sounds
Perfect.
good.
Until next
Okay.
time, have a great summer. Bye.